get in.
Hello, it is October 15th, 2025, and we are so glad you're here today. Today, we are going to talk about how to prepare for your visit and what to expect at the visit. So, kind of the hormone conversation playbook. And we have finally, it is episode 45, but we have finally gotten our crap together. And this is the first episode we're going to have on YouTube. So,
Oh my
hello.
gosh, look at us.
Hello.
It's taken us almost a year to get here.
We are not
Hey.
Taylor Swift by any means. We do not have a crew. We do not have anybody.
This is not New Heights, Kelsey Brothers, but we're coming in hot.
Yeah. This is us ordering equipment off of Amazon and figuring out how to get it onto YouTube. So This is our first episode that's on YouTube. So y'all go check that out. Our YouTube channel is Hump Day Hormones. But yes, it is October 15th and we are smack dab in the middle of Menopause Awareness Month. And also October is Breast Cancer Awareness Month.
That's right.
So
get your mammograms.
Learn about menopause.
That's right.
All the good things. And then I just want to do a quick reminder. So next week, we're actually going to be off for fall break. Just going to kind of spend some time with the fam and not have to podcast prepare over the weekend. But I want to remind you that the next episode will drop on October 29th. And that's going to be our 1-year anniversary.
Oh my gosh.
So that's exciting.
I know. I cannot believe that we've done this for almost a year.
I know. I really, but it makes sense. Like 45 episodes. That's almost. We've taken some weeks off here and there, but
we've done a lot. I feel like this has been a super helpful. I do have a lot of patients come back and say like, "Hey, I listened to either all of the episodes or hey, this one specifically," and it like makes sense.
Yes,
I was like, perfect. That was literally our goal behind starting this.
I know. I feel like a lot of this stuff needs a longer conversation and it's nice to be able to refer patients like, okay, we're going to put you on progesterone. Go listen to the progesterone episode or whatever. But, if y'all want to see our faces, they're on YouTube now. I don't know if that's a good or bad thing, but they're there. But submit your questions either through the email, humpdayhormones@gmail.com, or you can message us over Facebook or Instagram, just with questions. That's what our whole 1-year anniversary episode is going to be, is just a whole Q&A. From questions that you guys have, not your specific medical situation. So we can't answer patient specific questions, but more just sort of general hormone questions.
Yeah. Or other topics that y'all want us to dig into. And we were just talking about our next series. What is that going to look like starting in November? So new things to come.
I know. I love a good series. I think we're just going to start head to toe.
Yeah.
I have a local ENT doctor that reached out to me and just was talking about how hormone issues that he sees in the head and neck and how that affects women's voice changes and dry mouth and things like that. And he wants to come on. So that just made me think about doing whole head to toe. So that's going to be next. But today we are taking it back to the beginning. So we're not really doing science and studies and things like that. It's just simple questions that a lot of women struggle with. Okay, I feel like I have some issues, or maybe I think I am perimenopausal, menopausal, but how do I talk to my provider about that? Or just hormone issues in general, PCOS, fertility, anything, right? How do you bring that up in a way that it's going to be received well and you're going to feel heard? And so I feel like if you've ever left an appointment thinking, well, that was unhelpful, or felt brushed off when you brought up some symptom that you felt was related to hormones, like hot flashes or brain fog. That is the kind of stuff we hear all the time when we are doing consults. Courtney's mostly doing our new patient consults, but people come here because they said they've been a couple other places and haven't felt heard. So we just want to talk about like what can you do, sort of that playbook, like how do you go into that so that you can get the most out of your hormone visit? Like what do you need to be doing to prepare?
Yeah. And so there's kind of a lot that goes into having a successful visit. And so that includes like, how do you schedule it? Like, this is not going to be your annual wellness exam kind of appointment. Who are you going to? So you may just like talk to the schedulers whenever you're scheduling your appointment and say, hey, I maybe want to talk about some hormone things or changes going on in my body. Am I coming to the appropriate person? Are you prepared? Do you know what you want? So we're going to kind of dig into all of that. Like, what are your symptoms? Maybe tracking some symptoms. What are your goals for like treatment? So there's things that like we do as providers, but then there's things that you can do as a patient just to get the most out of your visit.
Yeah, and I think I'm big on women being like an active participant in their care. So not just a passive, like you come in, we notice you're 50, we bring it up, but like you being an active part of your care and kind of making informed medical shared decision making. I mean, that's what this is all about. Like we provide the information, you let us know what's going on, and we work together to come to a solution. So
that's right.
Yeah. And then I know we said that we weren't going to talk about studies in science, but I just have to
throw a couple in there.
I know. I feel like otherwise it seems like, does this really happen? Is this really a thing? Are women really being brushed off? And yes, there is evidence that women are not heard about hormone related issues. There's multiple peer reviewed studies and reviews that find that women reporting hormone-related symptoms, so that would be menopause, perimenopause, PCOS, chronic pain that overlaps with menopausal type issues or hormone conditions, they frequently experience delays, minimization, or dismissal by their clinicians. So multiple peer-reviewed studies show that. This shows up as diagnostic delay. So like maybe you have to suffer longer with your symptoms because you were delayed with that, or being labeled as anxious or stressed out, or being told that you just need an antidepressant or anti-anxiety medicine. I mean, it shows up in those sorts of ways. Okay, so the proof, the science. In 2018, a study out of Pain Management and Research, it was a literature review of over 77 studies, and it showed gender norms influence how clinicians interpret women's pain and symptoms. So, I mean, it reminds me a lot of the episode we had about races and racial disparities in care. I mean, there's gender disparities in care too. I don't know that we needed a study to like tell us that, but just I feel like it makes people believe you more if you back it up that way. But women are often labeled as emotional or over-reporting their symptoms. It's almost like if a man said the same exact thing, we'd believe him more.
Yeah.
Yeah.
It's really sad.
Yeah.
I mean, that's like, oh my gosh, like you have a patient coming in and telling you X, Y, and Z, and you're like, oh, you're just stressed out. Like, no. I mean, and you might be, but there might be some other things going on.
I mean, we all are. And like most people say, like, I have the same stuff going on in my life right now. I mean, it's like my best friend. That's what's happening to her in menopause. Like, I've been having 4 kids. I've been, being a mom and doing all the work and doing all the things I'm doing, but now I'm more anxious. And that, when you're doing the same things and things are changing, sometimes that's a telltale sign that it is hormonal. So one more 2023 menopause care review. It was based on interviews with patients and providers. Many women avoid or delay asking for help with menopause because they previously felt dismissed. So, I mean, that's embarrassing to some people. And most people think like, well, they're a doctor and they know. So if they said I was just having anxiety, I mean, I guess that's true. So they just won't continue to ask. And so And then it also showed in that same review that we have gaps in primary care menopause management. So and I think that falls back on training.
Yeah.
You
Yeah.
know,
We know there's that huge gap there. There's not learning much about like midlife care for women in like medical school and nurse practitioner school and all of that. And so, I mean, it kind of starts there for sure.
I know. And I think it's just people in general. If you're not comfortable with something, you don't want to talk about it. I mean,
Right.
you're just going to avoid the topic or sort of gaslight and move on, you know? And then I can't ever forget where the word hysterectomy even came from, was that we thought that the uterus was this was way back in the day before we really had good science or anything. But, you know, kind of they thought that the uterus made women sort of go crazy and hysterical. And if we would do a hysterectomy, that they would be normal again.
Yeah.
So, I mean, let's not forget where we came from. We are far from that, but we still have some disparities. So
that's right. That's right.
Yeah.
So yeah, these conversations are hard. There's reasons behind why they're hard. Like we said, like many clinicians still get limited or no training in menopause management. There's not like a standard. There's not a protocol that says like, hey, you have to learn X, Y, and Z to be able to pass this course, you know, related to like midlife care of women. So I mean, there's a big discrepancy there.
I mean, if you come in like thinking you're having a heart attack or a stroke in the ER, there is well-defined protocols that every ER across the nation is going to pretty much do the same thing.
Yeah.
I mean, it's very standard of care, and we just don't have that. But I think the important thing to know is there's people like us all over the country doing this exact same thing. I mean, a lot of people, believe it or not, that are more important than we are, and are really like able to have conversations at the level of the FDA and medical societies. And so the system is catching up to the science. I feel like we have a lot of the science. We obviously always need more, but the system is catching up. So we will get there. It just is going to take time, in that what people learn right now, we're probably not going to see in clinical practice for 15 to 17 years is what studies show.
Yeah.
So it's a slow moving
And
train.
I think that can be hard for providers because they want like concrete guidelines and things to follow. Well, that's not the case right now. That I think eventually will come, like you were saying, you know, years down the road. But that doesn't mean you need to wait years down the road before you can start, you know, helping these women.
That's
like use what we know now and do some good care.
That's right. So, okay, how can you be an active participant preparing for your appointment? I think, like Courtney was saying a second ago, it just kind of, at the very, very beginning, you finally make the phone call. How do you schedule? Did you book enough time? Maybe ask for extended time. Like, do you spend a different amount of time with patients that are coming in for this versus patients coming in for something else? Like, I want a hormone spot specifically. I want to talk about menopause. Like, make that known on the front end so that you can be scheduled ahead of time.
And your provider will appreciate this because hormone conversations are not 10 or 15 minutes. I mean, these are like a solid 30 minutes, if not more, that we need to like sit down and talk about all the things. And so going into it that way, knowing that you have symptoms that you want to discuss, ask if you can be booked in a bigger time spot.
Yeah. And I mean, just to toot our own horn here, I mean, we have started doing this around here. Like all of our new patient hormones are 30 minutes. And then I have even started to transition some of my annual exams. Like if they are 40 years old or older to a 30-minute annual appointment, because I know that they're going to come in and have something that is probably perimenopausal or hormone related. I mean, I practice in a community where it's kind of known that we do hormones. And so a lot of people are booking annuals with me because they want to talk about that. So we've started extending the kind of over 40-year-old women group to 30 minutes just to allow time for that. And sometimes we have to have a repeat visit to come back after we've done labs and all of that. So it's just going to require more time. So schedule it correctly on the front end. Don't just schedule an annual and then think you're going to slide this in the door or in the conversation as like we're ready to walk out the door. Because it's like we want to be able to dedicate the time to that. But, we have schedules and we don't want to keep patients like waiting forever either on their appointments. So
that's right. Yeah.
Yeah.
And like we said before, if you're not coming to us and you're going to somebody else, which is totally fine. I mean, ask like, hey, do these providers, care anything about hormones? I think I may be having hormonal issues and I want to talk to them about it. And if the answer is no, then move on and find somebody that wants to have a conversation.
I mean, the office schedulers will know that. Our schedulers know if women call up here and they're asking for that, they're going to get booked with me or Courtney. If you call up here and you're asking about something else, like maybe bladder prolapse or, that's going to probably get booked with like Burton or Cope. I mean, the schedulers at most offices know like
who does what.
I don't ever see this being put on this kind of doctor's schedule. So, I mean, I guess. They do that all the time. Sure. So the schedulers are going to know just because they're the ones booking those day in, day out appointments. And then another good resource that we always talk about is the Menopause Society, menopause.org. They have a list of providers that will be in your area that will help narrow it down. I mean, those people did special training just in that, so they're probably gonna care about it a little bit. And then, like I said, you have to be an active participant, so come prepared. And so, like kind of you have evaluated your own symptoms and you know what's going on. So maybe track your symptoms. And so there's apps out there that do that. You can just write some down. But I mean, when patients come in and say, I just don't feel like myself. I mean, we hear that all the time, but like, we need to know a little bit more. Yeah. Is it you don't feel like yourself because you have brain fog, because you're not sleeping, because you're depressed, because you're in a bad mood all the time? I mean, we need specifics. Is it all the time,
or is it like, are you still having periods and it's around certain times of your cycles? I mean, that kind of stuff really helps.
Yeah, and I feel like it makes clinicians like take patients' complaints a lot more seriously if they come in with it all sort of lined out, And so I just want to go through, like if we're telling you to come in with your symptoms, I just want to go through sort of head to toe. This is a long list. I mean, it's almost like 2 pages typed out here.
It's wild.
But these are things on the list that might trigger, and you might be like, I have all 52 of these things. But what, then we're going to say, well, what bothers you the most? I probably can't fix 52 things right now, but let's chip away at it. What bothers you the most? And so let's just go head to toe. So brain and mood are sort of like everything neurological. So brain fog, forgetfulness, worsening ADHD, trouble concentrating, your irritable mood swings, anxiety, depression, insomnia or disrupted sleep, like the dreaded 3 a.m. wake up and can't go back to sleep kind of thing. And then obviously if all that's going on, fatigue. So those are kind of the brain things maybe.
And then things that involve like eyes, mouth, and skin. Dry eyes or gritty feeling in your eyes, blurry vision can actually be hormone related. So like the curvature of the lens changes with hormone changes. Crazy.
I know.
Dry mouth or burning mouth sensation, dry skin, itchy skin, acne, oily skin, adult acne, blah. Increased facial hair, thinning eyebrows and eyelashes.
Yeah, and then the hair on your head may be thinning, gets brittle, dull texture, breaks easily. And then like thermoregulation things like hot flashes, night sweats. I feel like those are the quintessential menopausal things that honestly are a more later on phenomenon. I feel like the earlier phenomenon are usually the brain and mood things.
For sure.
And then chills. I mean, people get these like mostly temperature swings.
Yes.
Like then they'll go from kind of this hot flash to this chill all of a sudden.
Yeah. And then like cardiovascular and metabolic kind of stuff. So heart palpitations or fluttery heart sensations, elevated cholesterol. See this all the time. They're like, I eat so good. I'm exercising like I'm supposed to. My LDL just keeps creeping up.
Yeah, or they'll be like, I think your lab's wrong. I've never had high LDL.
Yes. Yeah. Weight gain in that midsection, insulin resistance, blood sugar swings, fatigue after eating, water retention, bloating, all the dreaded things.
Yeah.
I know.
The muscles, joints, and bones, joint stiffness and pain. So kind of this new onset, like, did I just get arthritis in my knees and my hips all of a sudden? Muscle aches, decreased muscle tone, or kind of that slower recovery, workout fatigue. You can't lift as heavy at the gym. It takes you longer to recover. And then bone loss. I mean, we know that's happening. Bone loss and increased fracture risk.
Circulatory and skin stuff, easy bruising, slower wound healing. And I'm just going to like throw it in here. Yes, there are a lot of symptoms that can be hormonally related. That doesn't mean they all are. Like other things need to be ruled out as well. But these are just all things to kind of think about. Obviously, we're going to dig in and like do the work and make sure.
Make sure it's not something else.
Yeah, for sure.
I mean, you're all sick of this list. I'm sick of it. So digestive system, bloating, constipation, irregular bowel habits, food sensitivities that all of a sudden just came on. Those really hadn't been there before. We talked about all last week, the estrobolome and the changes in the gut biome and the shifts that happen there. So we know that there's definitely some gut things going on. But like Courtney said, I mean, you might be having something else too. But we can help you kind of dig through that. And then I do think it's important. I mean, this is an aside, but like we're saying, I mean, we're going to dig through all of these things, but sometimes it is that your hormones are fine. And you know, like maybe we are not trying to gaslight you. We have looked through it and we've looked at everything. And most of the time there is some modifiable something.
Yeah.
But I mean, if you've gone to a hormone provider and had all the conversations and the labs and the workups and been heard and looked through everything, and we're telling you that it's really not your hormones, I mean, we need to be receptive to that too. I feel like it's been all over the internet and TikTok and Instagram and things that kind of everything is hormones. And there's a lot of things that are hormones. I mean, we're just halfway through this list, but it's not all hormones. I mean, sometimes it's other things. So we need to also be receptive to that.
Yeah. We know everything in the pelvis is likely so related to hormones.
Yes.
So urinary urgency, frequency, stress incontinence, recurrent UTIs, burning or discomfort with urination, feeling like your bladder never fully empties, and then like the vaginal and sexual health stuff, vaginal dryness, irritation, pain with intercourse, decreased libido, difficulty with arousal or orgasm, vaginal pH changes, which makes you more prone to infections, and then thinning of that vulvar tissue, which is vaginal atrophy.
Yeah. And then you can get some restless legs at night, swelling, puffiness, bloating, tingling in your hands and feet, and then kind of that emotional realm side of things, lower stress tolerance. So like your cortisol just goes nuts when the smallest thing happens. Feeling disconnected from your partner or yourself, like that I just don't feel like myself feeling.
Yeah.
Or I really love my husband, but all of a sudden I just don't even like him at all.
Yeah.
He's on my nerves. I mean, maybe
Mm-hmm.
he is on your nerves for another reason, but this, I mean, we know is a big time that people start to feel disconnected just because all the things are going on in your body that he may not understand.
Yeah.
So maybe bring him with you. But changes in desire for social interaction, crying easily, anger spikes, or just feeling like emotionally numb, like the I just do not care club. But I mean, I'm exhausted from even talking about that list. But those are all things to jot down that may be helpful for us to know. And then I feel like a helpful place for you guys to go. You can find it online, and I don't even know how this works. Like, I'll make a YouTube video. Maybe I can put the link in the video.
Okay.
I don't know. I mean,
do that.
We'll see. There's this thing online called the Green Climacteric Scale.
Yep.
Green, like the color, with an E at the end. And it is one of the most validated scales used to like kind of see where you are in menopause. And it's 21 questions, and they cover 5 domains. So anxiety, depression, somatic, like actual body symptoms, vasomotor symptoms, and sexual function. So if you do that, you can answer these 21 questions. If y'all look it up online, just Google green with an E scale. And if you get a score of 15 or more, it usually indicates some estrogen deficiency that's intrusive enough to require treatment. This is only a guide. So it's not like, oh my gosh, I got a score of 16, put me on some estrogen. But it's a good guide. And then women are pretty variable in their tolerance for discomfort. So some people might score a 20 and be like, I'm fine. I don't feel like I need anything. But a score of 20 to 50 are usually pretty symptomatic people. And kind of getting into that more menopausal range. And then with adequate tailored treatment, you should be able to give people that same scoring system, green score thing again, and get their score to reduce to 10 or under in 3 to 6 months. And so it's a good way to follow things and track your symptoms and see if things are helping.
I think that's a good reminder too. I mean, it says in 3 to 6 months that these like treatment options, whether it's hormones or whatever else, it's not going to be overnight typically. Now, in some people it is, and I'm like, okay, great. But a lot of people, it's a little bit of a like back and forth. Like, okay, let's tweak this based on this symptom, or let's, go up on this or whatever. So it's a little bit of kind of back and forth for a few months. And I think that's so appropriate, like 3 to 6 months. I feel that is very common.
We just listed like 52 symptoms. Obviously, they're not all going to go away in 2 weeks.
Right.
We're going to have to, like Courtney said, chip away at it. But Yeah. And then also in the being prepared for your visit kind of thing, bring a list of medications, obviously, that you're on, but then supplements too. So what have you tried over the counter? What has worked, not worked? And then if you've had any recent labs, like somewhere else at your PCP, we want all those, like even if they're not a hormone, we want your cholesterol and just blood count and electrolytes. We want all that stuff. So anything that you've had recently, try to get your hands on it, or most people can pull them up on their phone these days. Yeah. And then talk to your family. So is there a family history of thyroid disease or diabetes, or like your mom and your aunts or your sister went through menopause early, like early 40s. I mean, that's all super relevant to know. So maybe if you don't know, I mean, most people don't know when their aunt went through menopause. Like maybe kind of text or make a phone call and sort of dig in and figure out if you have any family history that's relevant.
Yeah. And know your like top concerns, like what are a few of like the biggest things that are really affecting your day-to-day life? And write those down. I have a ton of women that like have them in their phone and they're like, I don't even know, like, can I pull my notes out? I'm like, yes, please pull your notes out. Yeah. And they're, they can say like, yes, I'm not sleeping. I'm like waking up hot, or I'm super anxious, or brain fog is killing me at work and I can't even do my job right. So come prepared kind of with that stuff. And come fasting for that initial hormone consult because I'm going to get some labs on you.
Yeah. And not all the labs have to be fasting, but it's probably too hard to kind of tell people which ones we're going to get up front until we have heard your symptoms. So if you're just fasting, we'll know that we can be sure and draw the right ones.
That's right.
And then the next little section we're going to talk about is just know your goals. So when I was writing this, it just reminded me, one of my favorite movies or books too is The Notebook.
Yes.
I know. I used to watch that movie.
So good.
John was so over it, but and he would always or there's this scene where he's like, "What do you want?
Yes.
What do you want?" And so I feel like it's that. Like, know what you want at your hormone consult. Know your goals. Yeah. You want, like, I want my hot flashes to go away. I want to sleep better. I mean, I want to feel better is not very descriptive. So we need a very clear cut, like, what do you want?
Yes.
And so having clarity helps guide the visit, and it's going to help you leave with, like, I went in there saying, I want help with my hot flashes, and I left with a plan for my hot flashes. It's going to make you feel like you left the visit with kind of that direct thing answered. And so be direct, like, say things like, I would like to understand if my symptoms are hormonal and what testing I could have to clarify that. Like, especially if someone's not used to kind of doing stuff like this all the time, you may have to be direct. Like, I think my symptoms are from hormones. Will you test my labs?
Yeah.
Like,
I know. I think this
out.
is the time. I mean, for sure, I feel like you should do this with other things in your health as well. But I have so many women that are like, I mean, my hot flashes aren't that bad. I mean, I sleep okay. I'm like, no. I mean, like, let's get to this.
Yes.
Do you want 0 hot flashes or like a huge reduction in them? Okay. Do you want to sleep better? Okay. Like, come at it.
And I think if somebody, like, offers you birth control or antidepressants or things that you've been offered in the past, maybe just say, what options do I have beyond that? You know,
for sure.
And I love this kind of statement. It says, bring data, not drama. So instead of saying, I feel terrible all the time, try, I've had night sweats 5 times this week and haven't slept through the night in months. Like, that sounds so much more descriptive, and I understand what's going on than I feel terrible all the time. Because as a provider, you're like, well, I don't know that I can make you feel better all the time. I mean, I don't know what that magic is, but I know how to fix night sweats, and I know how to help you sleep. And I know, you know, so if you give me targeted things, I can give you, like, a targeted approach to that.
Yeah.
So that's going to help your, like, clinician be able to know the impact of what's going on if you give a direct example like that.
I mean, I had a girl last week that was telling me that she was, like, driving, you know, like, on her way to work, and looked up and was in a complete fog for the last, like, 10 or 15 minutes. Like, luckily she was safe and everything was okay. She was like, I cannot continue to, like, live in this brain fog. Like, something has got to change. Like, perfect. That was a great example.
Yeah. And then you can put yourself in that person's shoes and be like, man, I don't want to be driving potentially with my kids in the car. And then all of a sudden feel like I don't even know where I'm going or what I'm doing. I mean, you know, you can totally empathize with that person and get in that moment. So, and then, so let's just say you've done all these things, you came prepared, you had the labs, you talked, all the things, you decided that hormones were right for you. Then there's some questions you can ask about those treatment options. So just, hey, you need some hormones. We talk about that all the time. It doesn't need to be like, well, I'm a hormone provider, but I only give hormones this one way. Here's your special cream that has to be made from this special pharmacy, or here's this one pellet, and that's the only kind of thing that we offer. That's a red flag. They need to lay out options for you. And so your questions would be like, is this transdermal? Is this oral? Is this bioidentical? I mean, all of those kind of, and like, what are the risks? What are the benefits?
And people get really surprised whenever I do this. And I'm like, okay, like, here's the menu.
Yeah.
Let's just like here I think are some really great options that we can start with. And they're like, wait, you want me to choose? Like, what do you mean? Like, I get to make a decision? I'm like, yeah. Like, what do you think? Do you want to like apply a cream every day? Do you want to change out a patch twice a week? Maybe you're a good candidate for a pill. Do you want to take a pill every day? And they're like, oh, I'm not used to this.
Yeah.
I'm like, let's just start somewhere, and we'll walk you through and guide you through that.
Yeah, and you're gonna have to be the one that keeps up with that. So, like, if you're not gonna want to rub a cream on every day, then you're not going to be compliant with it, and it's not going to work. So I think it's important. And some patients say, well, I don't know, just tell me what to do. Yes. And we can say, like, okay, we should not do a pill on you because of these risk factors, and I think a cream would be best because of this. I mean, we can like suggest to you, and we will if you want us to, but I want you to be informed of why we're picking what we're picking.
Yeah.
So, and then I think that it's important to ask, and I think this is a big deal in the hormone world. You cannot just give someone some sort of hormonal treatment and just hope this works. Bye. See you later next year for your annual. I mean, that's not how this works. So it is so important that when you start hormone meds or treatments that you're going to be followed up, and are they working, and potentially did your lab levels move at all? Like, are you absorbing either the cream or the pill or whatever you're using? So ask, like, how will I be monitored? There should be a very clear-cut system around that. I mean, for us, we're usually seeing people back in 2 or 3 months and potentially repeating some. I mean, it's not usually all, but some of their labs. And then we want to have a conversation with people, like, because it matters how you feel more than it matters what the number is on a piece of paper. I mean, your number may look perfect on a piece of paper and you still feel like crap. Well, I mean, maybe estrogen is beneficial for you, but maybe it's not, getting to the root of that symptom. And so we need to go down the gut pathway or whatever. But you have to be followed up, and there has to be a plan for that. So if someone's just giving you hormones, or for sure, like putting pellets in you and never doing follow up, that's a giant red flag.
For sure.
Yeah.
And then there's, other options like non-hormonal options. If you're like not a candidate for hormones, or you don't want to do hormones, there's other options that are available too that can like help with vasomotor symptoms or sleep or anxiety and depression and all of that kind of stuff. And those are things that we talk about too. I mean, I can think of like a handful of women off the top of my head that I've seen in the last couple of weeks that they're like, I don't know if I want to do hormones, but maybe what are my other options? Or they're just like, maybe not a candidate, which is very few and far between, that you wouldn't be a candidate. But yeah, there's other things like SSRIs, gabapentin, Veoza is a newer medication that can be really helpful with hot flashes and night sweats. And so I think kind of knowing all of those options and pros and cons of those as well, it could be helpful.
Yeah, and it's okay to like not want anything. It's okay to just want to be informed about what's going on in your body. I just wanted to know that I was perimenopausal, or that I am menopausal. I don't want to do hormones because of XYZ, or I'm just uncomfortable with it, or whatever. I mean, that's okay just to want to know. It's your body. You deserve to know what's going on. But and I think, we talk a lot, I don't know if all providers do this, but we talk a lot about supplements. I mean, I think that there's some crazy ways that supplements can really be beneficial, and you don't always have to be using like a prescription hormone. So we talk a lot about that. I mean, I do think that we are really have a good system set up for like giving people, we have a summary sheet that we give people at the end of their visit that just says like what they're going to be put on, either prescription wise or supplement wise. And then we partner with a company to offer supplements, like you don't have to buy them from that company, but just a way that we can send you an email that links supplements. You can either buy them off Amazon, you can buy them directly from Fullscript, but just a way that we can link directly, like you need this much vitamin D and this much, whatever, B12 or this probiotic with this certain bacterial strain in it. And so we have a good system set up for like getting people that information. But yeah, you shouldn't be left with just like, I don't know, they said all these things and they're rolling around in my brain and I can't remember what they said. So either write it down yourself or, like at our office, you're going to get this printed out sort of plan of care.
Mm-hmm.
And then, so what happens if you did all this? You were so prepared and you went and you asked the questions and you filled out your green scale ahead of time and all this. And then you go in and you're like, well, that didn't go well.
I know. I hear that all the time and it literally breaks my heart. So,
but don't give up. Like, it's okay to get a second opinion.
Yeah. It's okay to go to somebody else. I mean, even if you've been to the same doctor for, all the years and doing all the things with, I mean, it might be time for a change during this time in your life. And that's okay.
Yeah. I mean, maybe somebody was like really awesome at delivering your babies.
Yeah.
But maybe they're not that awesome at talking about hormones. And I mean, that's okay. Like everybody has a skill set. I mean, it's hard to be good at everything.
Yeah, and I think it's helpful too if you bring like your friend or your mom or your sister or your husband in, because they can even add in some, either some symptoms or ask some questions that maybe you were going to ask and you forgot. But it's nice to kind of have, a whole little partnership and a whole little conversation with somebody else in your life as well.
Yeah. And so I loved this little quote I came across. It said, you're not being difficult. You're just being your own advocate. So don't patients always apologize. Like, I'm sorry, I feel like I'm being so annoying. And I do that too with things, but you don't have anything to apologize for. It's your health. You live in this body and brain and feel like this all the time. So be your own advocate. And that's really what good healthcare is all about. I mean, patients say it all the time to me, thank you for listening to me. I'm like, well, you're welcome. That's actually my job.
I know. And I think that people apologize so much because they've been like dismissed and gaslit so much.
Yeah.
And literally, if you just listen to them, it's, they're so thankful for that. Listen to them and give them a plan.
I know. And I always compare
this is not hard.
Our job to like just any other job. Like you wouldn't like make a consult for your air conditioner and then have the air conditioner man show up and not listen to what's been going wrong with your air conditioner.
That's right.
I mean, it's a little bit different than an air conditioner, but it's the same concept. It's like literally our job to listen and try to walk you through this. So to wrap it up, schedule the right appointment, like an actual hormone focused appointment. Go to the right provider, somebody who is proficient and trained and knowledgeable in this arena. Come prepared with your symptoms tracked or, your specific things you want to address. And know what you're asking for and just don't settle for being brushed off. So
that's right.
I did make a downloadable PDF, like a Adobe kind of checklist of how to have a successful hormone appointment that just lines all this out. You can email us for a copy, and then we're also going to try to post it on our website. I emailed our website people about trying to get that up there and then try to link it on our social media somehow.
We'll figure it out maybe. Or just email us at humpdayhormones@gmail.com.
Yeah, and
we'll send it to you.
I can send it directly to you. So menopause is not something we just have to get through. It's not like tough it out, grind it out. It's not, no. This is a third of our life. We're not going to just halfway make it through. But you deserve to feel well in this season of life. Physically, mentally, emotionally, sexually, all the things. And so if this episode resonated with you, share it with a friend who's struggling to be heard or just has been talking about, I'm going to try to make this hormone appointment and I don't know really what to do. Share this with them. And then if we just keep talking about this, eventually enough people are going to hear it and listen, and we're going to break the stigma that is around
right.
women and vaginas and hormones. So
That's right.
Follow us on Hump Day Hormones, Instagram and Facebook, and also the Women's Clinic, which is arobgyn.com. I'm going to try to link all this on this YouTube. I mean, it's probably going to take me, we're going to post this podcast on Wednesday like we always do on Hump Day, but it may take me all the hours between now and then to get this YouTube video made. We'll see.
You're so smart. You can do it.
And then email us your questions for that anniversary episode. And then be so excited because starting in November, we're going to do some head to toe menopause. Just like
I'm excited.
I know, like we went through that list, just head to toe, you know, what those symptoms are. And then, next week we're going to be on fall break. So we'll catch back up on the 29th.
Yeah, just a reminder, everything we talk about here is for informational and supportive purposes only and is not medical advice. There's no doctor-patient relationship established on this format. Your body is unique, so be sure and chat with your healthcare provider before making any changes to your health routine.
Y'all have a great week. Next week, I'm going to wear lipstick.
Oh, maybe I should too.
We weren't prepared for the
We may wash our hair too.
Yeah, maybe. I don't know.
That did not happen last night.
Mondays are my off day, so y'all just this is as good as it gets. But maybe lipstick next time. And then, did y'all see how cute these? Or this is not the camera. Moving the screen won't help. Did you see these cute camels?
Like here's us right here.
Oh my
right
gosh.
Here, and our what was this camel's name?
Rocky?
Rocky, yeah. Mm-hmm. Yeah, the white one was Gloria. Mm-hmm. She's not in the picture. This kind of looks like
Gloria's pregnant again.
She is?
Yeah, so the owner of the camels is my patient. They own Cockrell's family animal farm here in Cabot, Arkansas. And she's my patient. And yep, she told me that Gloria, their camel, is pregnant by Rocky.
Oh my gosh.
Yes.
We're going to have to go see the babies.
I know. Love it. So welcome to our studio. Thank you for being patient with us as we figure all this YouTube stuff out. And we will see y'all next week.
Happy Hump Day.